Hi, Dr. Donna Kinchlow. We're on session 5 of Excellent Questions. As you know already, we were watching Grief, Loss, and Spirituality, and a brand new nursing group gave us questions, and they've been wonderful. And so we're going through all the questions to try to help equip you to be competent when you're giving and providing care to those patients. When a person gets dementia, why is it considered a situational loss? Situational loss is described to be a loss caused by unusual and unexpected circumstance. When compared to maturational loss, you have to be a little bit of a wordsmith. You have to take a look at the words. When I mature, I'm going to go through my lifespan and my adolescence, and I'm going to go to college, I'm going to go to high school. There'll be certain losses. I'll have to leave home, I'll have to become independent. You get your nursing degree, you're going to get an apartment, you're going to live with some people in a rental house, whatever you decide to do. Those are losses and changes in life that are pretty much expected. But when you have a situational loss, it creates an unpleasant and an unexpected and sometimes permanent or lifelong change. And dementia fits that description. Dementia is unexpected and it impacts the life of both the caregiver and the person inflicted with dementia, and it's not reversible. Dementia is when both your memory and cognitive deficits interfere with activities of daily living. Things you used to do, you can't do anymore. You may even get to a point where you don't even remember your family. So you consider the uniqueness of dementia. The person is physically present and yet cognitively absent. And that's very difficult. Now, the circumstances and set of circumstances is a gradual loss of identity and the constant cycle. It's compounded loss over time, one loss after another after another. When you think about the stages of grief, you can get through some of the stages and almost look back and say, okay, I think denial, I'm finally getting to a point where now I'm angry or I'm bargaining and of course there's no time frame for any of those, but it's like a stair. You've got consistency and you can see where you are moving forward, making some progress. The saddest part of the grief that is connected to dementia is it is complex and it's got an early stage, a middle stage, a late stage, and it's a blend of anticipatory loss and ambiguous loss. It is such a sad state. The entire course is a stacking up of the losses, and there's no boundary, there's no clear-cut stair step, no clear-cut expectation. The grief of the caregiver is a sad cycle, loss upon loss upon loss without any resolution at any point in time. Dementia is definitely unexpected, unplanned, and does change your life. Know that caregivers of dementia patients need support, and the research has found often they will pass away, how you like that word, or they will die before the one that has dementia, the one they love. And so they need our support. Do you think the words dead or dying are more offensive than passing away or deceased? Have you ever heard the term euphemism? A euphemism is a phrase or a substitute to reduce offense. And that's exactly what the student is asking. Is it more offensive to say, oh, Donna died? She's dead, deader than a doorknob. So euphemisms are to soften things. If I would lose my job and you would find out and you're telling people and you'd say, ah, Donna got fired. Or you could say, Donna's job was cut. And you, oh, well, that's a little bit of a euphemism, right? They let her go instead of she got fired. So people saying dead or died, it seems so final, so harsh, so brass for some people's ears. So sometimes you'll hear euphemisms. They've left this place, they've left this world, they're in a better place, they finished the race, they're in heaven. Now, where in the world did the phrase pass away or pass on actually come from? It was from centuries ago, because you see, there are a lot of faiths that believe that once your body dies, your soul lives on and you move on, or you pass on to heaven or to hell, whichever their belief tradition was. So several religions believe in this, that your soul will leave the body when you die. Now, some believe that when you're dead, you're done. I had a friend who was an atheist, and that's exactly what happened with him. He ended up being in hospice. Hospice came, the chaplain said, now we need to know what you believe about death and dying. We are a Christian organization. Here's what we believe, and we will pray for you, but we'd love to know your thoughts on death and dying. And being an atheist, he just planted it out there just like he always had. He said, well, when I die, it's going to be as if I was never born. I'll be dead like a dog. And that is what he believed. So when you are with people, either in the hospital or at the funeral home, and people are grieving, take notice as to how they are talking about the person who's passed on or died. And you can use their words, and you know you're not going to offend them. And usually using passed on or passed away, it's not going to offend people. People are used to that euphemism. It's become pretty much stable in our words when we're dealing with death and dying. If a patient is asking a nurse specific questions related to spirituality and the nurse is not religious and does not feel comfortable discussing the topic, how should she respond? Or how should he respond? I want to let you know that being a nurse, if you are uncomfortable with any conversation or discussion, you are more than able to be respectful, but appropriately and firmly sometimes inform the patient of how their discussion is uncomfortable for you. If you have someone telling nasty, dirty jokes and you really don't appreciate that, you can let them know that, and you can do it kindly. When the topic is spirituality, you are never wrong as long as you're honest, as long as you are yourself. Be sure that your response is not tainted with anger or disgust. If you absolutely hate Christians, you don't believe what they believe, you consider them haters, you don't want that anger to rise up within you. And you don't need to let them know how you feel about that, their belief choice, or that you think that they're weaklings or whatever. You don't have to divulge your spiritual belief or non-spiritual position. If someone's asking you a question, it's so easy to just say, without a lot of emotion rising up, I really do not feel adequately prepared to answer your question, but if you would like me to, I'm happy to put a referral in and get a chaplain who I know would help go through these questions with you. That is a very easy way for you to keep your beliefs to yourself and respect their need to discuss the religious, spiritual questions that they have in their heart. Now, when you start reading some of the stories on grief and loss and traumatic death, some questions don't really have good answers. If they're asking questions such as, why would God do this to my child? Why would God, is he punishing me? Why would God, why? The why questions sometimes don't have an answer. And you can simply say that. You know, it would be nice if we had a handbook that actually told us, why, God, do you do these things? But we don't. And sometimes we don't know the answer to the why questions. One woman who had lost several people in her family said in her healing process, she began to turn the why and the why me and why God into Okay, Lord, I know I'm asking questions that have no answers, so I'm changing my question. And my question is now going to be, what do you want me to learn from this? And what's next? What's my next steps? That gave her peace. And everybody is going to be at a different space. And the greatest thing is for you to know that what you believe matters too. You are spiritual, you are physical, you have emotions as well. And so when you come to these situations where you feel that churning in your heart and spirit, it doesn't feel comfortable for you, be honest, I don't feel comfortable. But I can find someone to help you meet your needs because you have needs too. We don't have to put you in a place where you're uncomfortable. That would be so wrong for us not to respect you. The easiest way to discuss spirituality. Okay, what is the question? How should the nurse mention conversation of spirituality and the topic of death or dying without scaring or surprising a person? Well, I believe if you grab onto one of the very brief spiritual assessment tools that fits your personality and paraphrase things, you know, someone can give you a script, but until you make it your own, it doesn't have the same impact for me to say the same thing over and over again that you've heard from different people. It's not as important as when I put my words and my take on it, and the same with you. If you just ask one or two open-ended questions from a spiritual assessment tool, it'll be so helpful. It'll guide you, and it won't be threatening to you, and it won't be threatening to your patient or the family. So consider how you can rephrase some of the questions from some of the tools, the HOPE and the FICA, the FICA. How hard would it be to say, when you experience illness, where does your hope come from? Or what gives you hope? What gives you comfort? Do you have a spiritual support system? How threatening is that? If you do, how do they help you? What do they do for you? And if you don't mind to tell me, do your spiritual beliefs bring you meaning in life? Are your beliefs connected to medical care? And if so, how can I be of help in the days ahead? What can I do for you? And this is probably my favorite because this is actually my go-to. Are you a man of faith? Are you a woman of faith? How important is faith to you? Do you have a faith family? And you could pop in so easily. Once they begin to talk and tell you about those things, then you could simply say, what is your belief about death and dying? You know, what do you believe about that? And let them talk. You, as a nurse dealing with spirituality, it isn't really so much what we say as much as what we listen and hear them. We're almost like a catalyst. Let's open up this door. Let's listen and hear your story. And how can I best help deliver spiritual care for you? These questions are catalysts. What do you believe happens when you die? The truth about death is no one escapes it. We're all going to die, and we all know someone who's going to die or has died in our lives. Even if it's our dog, we understand. And at this point, if you have arrived at your own belief system, it's a great thing because as you are sharing with the patient these deep spiritual things, they might want to know your thoughts. And it's great if you know exactly what you believe about death and dying and spiritual things and faith. And again, honesty and open conversation. They're going to love you for even bringing it up. You don't want to scare them or surprise them. Now, I did have a man who was dying, and he was a friend of mine's husband, and he was very near. And he was getting discharged, and I wanted him to be connected to hospice so that his wife would have help. And when I brought it up with him, he said, "Oh, Donna, I'm not near that. I'm not dying anytime soon." And I wanted so bad to say, "Oh, but yes, you are." But he didn't believe that he was. And I couldn't change that belief. He was still clinging to the hope that his life was going to go on and he was going to be all right for a while longer. And we discharged him, and he went home that night and died. And I'm sure my friend had friends from church. She was the counselor from the church. So I'm sure she was surrounded with help. I felt sad that I know. But I will tell you this, he was not afraid. It wasn't so much that he was afraid of dying because he already had his faith was secure. And you're going to find that people who have a faith and they are secure and they have a hope, dying is not scary for them. You will find different ways that people will approach death. There will be people who maybe have been atheists for all their life, but then when it comes down to that actual time, they may want you to pray for them and they want to know about Jesus. They might want to know about heaven. They want to know, and they want that hope of eternal life. So that's why, again, it's so important for you to know your belief system and also your resources. That if spirituality and religion is not a part of your life, it is not important in your life, know how to access it for your patient. That is vitally important. How do you address spirituality with people who take offense to the conversation? I'm going to give you a true event that isn't about spirituality, but it always stuck with me. You know, we have an idea in our head of what we're supposed to do, what we're supposed to address. And I had a surgical patient. I used to work on a surgical floor and same-day surgery for a while. And pre-op teaching was so important to our checklists and healthcare providers. We need to give them that pre-op teaching. We need them to be prepared. We think the more aware of what to expect, the better their outcomes and how it will reduce their anxiety and let them know their expectation for a great recovery. And let me tell you, that is not true for every patient. I am in the throes of pre-op teaching, and a gentleman says loudly as he raises his hand, "Stop! Stop it!" I was doing thorough pre-op teaching. Quickly, I hushed. And then he said, "I don't want to know anything that's going to happen to me. I just want this to be over. I will be more anxious knowing. So please, I just want this over. Don't tell me anything." Okay, no more education. But guess what? Reassurance was welcome. Okay, Tom, I don't want to make you anxious. I will be here when you come back from surgery. Your surgical team is an excellent group. You are going to be in great hands. We will be with you and help you every step of the way. And he thanked me. We need to be aware when offense shows up, we need to be kind enough to realize for some people, a spiritual discussion can elicit a painful memory or guilt or discomfort. And if you see that in their nonverbal behaviors, if you see something on their face, ask them, is this conversation offensive to you? And let them tell you their story. Show genuine concern. Be in tune with what they're saying and what they're showing you by their nonverbals and their behavior. And that will help you guide them. You know that spiritual assessment for some organizations, you do have to go through some of those questions, and you just need to let the patient know why. Gently say, as a nurse and as our healthcare organization, we love to take care of your physical, emotional, and your spiritual needs. If this is uncomfortable for you and you don't want to answer questions or discuss this, I can just move on. And then say this, I respect you. Do you know how much that means to somebody? And then you might find, well, let's go ahead and do the questions. Because it's all how you handle it. It's all how you respond to their response. And isn't it amazing how you can make a change in someone's life? That's a great segue for this question. Have you ever been able to introduce spirituality into a patient's life that has never practiced or believed in anything before? When you go to work as the total person that you are, physically, emotionally, and spiritually, you don't change that. You are who you are. And when faith is important to you, people are going to know that. I walked into a patient's room. His wife was sitting beside the bed. They were the dearest people. And as we got to talking about his heart failure, it's the last 4 years of my career. I was the heart failure educator, and we got to talking about their life and what was going on. And when you see as many people as I have in 44 years, sometimes it's hard for you to remember everybody. Everybody's body changes. They change their hair, they whatever. And this man looked at me and said, you know, Donna, I want you to know that you changed my life. You changed both our lives. And I'm thinking, well, yeah, heart failure education will do that. It'll make you have a healthier life. That's what I'm thinking. But instead of saying that, I ask an open-ended question. Well, how on earth did I do that? And he said, you let me know God loved me. You prayed for me the last time I was here. And when we left the hospital, we found a church. And you made all the difference for me. Have you ever changed a staff member's life who had never practiced or believed in anything before? And the answer is yeah, and you will. Because you see, when you work with a team and you're a person of faith, there's usually going to be 2 or 3 of you, maybe 4, maybe more, who share the same faith you have. And I want to tell you a story. We had a ward secretary, and her grandson had been in an all-terrain vehicle accident and hurt his head, and he was traumatic brain injury, so they thought. And so they did a CT of his head, and she had to come to work, and so she's at work, and we just came out of the huddle, and we're heading for a report, and the 3 of us saw her sobbing at her desk, our ward secretary's central desk. So we came around and found out what had happened to her grandson, and we asked her, would you want us to pray for you? And she said, oh, yes. Sometimes prayer is so valuable. We prayed for her grandson, the 3 of us, and then about 2 o'clock in the afternoon, and of course we went from one end of the unit to another end of the unit and grabbed up other people that loved God, the night shifters, the day shifters, and we prayed and we prayed and we prayed for her grandson because she was so distraught. About 2 o'clock in the afternoon, she was so excited, and she called us all and said, the neurosurgeon came, took a look at the CT, said, I don't know what you people thought you were looking at. And her grandson was fine. And at Christmas, she wrote us a letter. It's one of my most wonderful things that you can do for yourself is save things that people give you. And at Christmas, she wrote us a letter and told us that that day, when the 3 of us prayed, that her heart lifted. And then when God answered her prayers, she ended up seeking out that same God and began church. She got off antidepressants. She stopped smoking. She has a joy and a love in her heart, and she called us her 3 angels. We had no idea, but we did know that prayer. When we prayed for that dear ward secretary, we didn't know her faith. but she was fine with prayer. And a lot of times it is that spiritual intervention of sincere prayer that will touch people's hearts and change them. I had no idea when I had that dear man and I prayed for him. I don't even remember. And it's not about us. It's about they had faith too. And when you know that your faith can change a person's life, and I have several other stories after 44 years, let me tell you, but I don't want to take too much of your time. Here we go. How do you learn to keep work separate from your own feelings in your home life? And I'm telling you sometimes that you cannot. There are certain things you can do. I love to journal, and I haven't been journaling, and I don't beat myself up if I don't journal every day. When I was working, I journaled all the time. Keep a journal of events. It's helpful, especially when you can grab one up and read what transpired and reread. The greatest thing about nursing is that you have to know that it's not all about grief and death and loss. The greatest thing is you're going to have more thanks from your job than you ever know. You are going to have so many joys that are going to touch your heart. You're going to have more fun in so many ways. You're going to work harder than you ever believed you could. You're going to form bonds of friendship that are tighter than any family genetic history. You're going to be grafted into people's families. And your life scale is going to tip with more good than bad feelings and memories, I am telling you. Nursing makes you the best father, the best mother, the best wife, the best friend ever because of your courses. You learn so much about human dynamics, communication. You become an educator, whether you knew it or not. You all will be educators. People are going to have respect for you. You know you are one of the most trusted professions ever. And you can never toss your work feelings into a laundry bag, head home like nothing ever happened during your shift when things are bad. But you need to have a comrade. You need to have a friend that you can trust. You will save lives. You will help people go to heaven. You will. You'll laugh and joke about some of it. A friend of mine, oh my, we had a dear man. He was so trying to die, and we'd gotten an order to send him to hospice, and I just love my friend. We didn't want him to go to hospice. We were afraid that if we loaded him up and put him in the ambulance, he'd die on the way because he was really so close. And my girlfriend pulled back the curtains and said, Sammy, go to the light. Go to the light. We loved him. Sometimes you just realize death is part of life. And we loved Sammy, and we didn't want to put him through all that. You never do anything by yourself. You're going to be a problem solver. You're going to develop a resiliency. You're going to have crazy humor that nurses have. We're known for that. You're going to be able to discern what you can share and what you can't, and when, and with who. So, how did I keep work separate? For many, many years, I had a very dear friend who worked across town at a different hospital. And so we would get together and we would cook. One of the things that when you're nursing and you're working and you're trying to manage all this, I am really good at making meals for the week. And so when my oven was on, I'd do a couple hours and we would put all these meats in the oven, pork tenderloin, chicken, a roast, whatever. And then I would know all I need to do is pull this stuff out. I'd make my menus and I'd do my sides. Sides are easy, especially if you have steamables. Anyway, so that's the kind of stuff my girlfriend and I would do. We would try new recipes and we would get together. And when we were together, we could chat, we could vent, we could solve the world's problems. But she was a comrade and we didn't have to use anybody's names and we weren't breaching HIPAA. Find a friend. Be a friend. Never stuff your feelings so far down in your soul that you become hard-hearted. Don't do that. Learn to deal with loss. If you have trouble, go get some help. Your organization will have a mental health freebie for you that you can go to when you've got issue. And don't forget, you're important and you're valuable. And you get those specific tools. I'm just saying. you're going to be who you are. And those feelings, you're going to have those feelings. You're going to come home and you're going to be so happy. And then the crazy thing is you're going to go out in the community and then people are going to spy you and they're going to go, you were my nurse. You were my nurse. And you think, oh my goodness, who are you? And where was that? And when? And they love you. And they never forget you, no matter what clothes you've got on. And that really is embarrassing, too, when they do that. Oh, I didn't hardly know you with your clothes on. And I think, oh, gee, anybody hearing that? They think I was a stripper. Yeah, that's what they'll do to you. I'm just saying. But it's a lot of fun because they never forget you. You're unforgettable. Do you have any advice how to deal with the emotional toll school and homework can take on you while you're in school? Absolutely. I probably need to do a whole YouTube on that for you because I have all kinds of great tips. You see, I was in nursing school I graduated in 1978, and I was a diploma school, and I also worked as a nurse tech back in those days. And then I moved to North Carolina, and I worked at a university hospital. I worked night shift. I worked a trauma unit. I worked all over the place. And then I moved to Evansville, and I went back to school, and I got my bachelor's. I got my master's in nursing education. I also got my doctorate, and my last degree I graduated in 2017. So most of my life I have done the juggle. And it does take a little bit of an emotional toll on you because you want to do really well. So I was somebody that when I was in high school, I got A's and B's and I didn't have to kill myself. Well, when I was in nursing school, in my diploma school, which they don't have very many of those anymore, but I would rather play my guitar out on the porch than study. And I had 50, there were 50 of us in my nursing class, and they were high achievers, and a lot of them were getting straight A's, and that just was not me. And so I had a friend, her name was Lynn, and Lynn would drag me up to her room, and she helped me with word association, and she helped me with poems, and with jokes, and with fun, and with mental pictures. And so I learned how to study differently. I learned how to make things fun and make it real and be able to sift as to what is truly important. And that's what's difficult. You get a 4-inch book, you get all these chapters assigned, you have all these webinars you've got to do, and then you guys live in a world where you are constantly distracted. For me to even get down into a Word document and start typing on something, I'm going to get smacked with all kinds of things. My emails are going to pour in. I'm going to be distracted. I'm going to be distracted. You're going to be distracted. So how in the world do you juggle it all without dropping the ball? The first thing that I would say to you is very, very important. And I know that during seminar, you were asked to do some type of personal review as to what kind of learning style best suits you, best describes who you are. For me, we didn't have PowerPoints back in the day, so what did we do? We had to take notes. Yeah, you would die to know what our curriculum was. It was crazy. We got up at 6 o'clock in the morning and we would go into the amphitheater and we had pharmacology from 6 in the morning to 6:30 every day. And then 7 o'clock to noon, we had nursing fundamentals. And then in the afternoon, we had the University of Pittsburgh people would come up and teach us all of our sciences. And it was a very long and crazy day. But you know what? We lived in the dorm, and I learned to be a tactile learner because I love to read and I love to write. And so you have to identify, who are you? Do you like to listen? Are you social? Do you need to talk it out with somebody so that you guys can discuss it? You like that verbal? You want to learn it and teach it to the dog? I did that. Or are you a person that just likes that mental, leave me alone, I want to learn this all on my own? I am not really an antisocial person, but when it comes to study, I just want to do it my own way, my own self. It doesn't make any difference. You just need to know who you are. We have crammed so much into your curriculum, so many clinical hours into your curriculum. There are only so many hours in a day, and I know that many of you are also working. So, there's some things I can tell you. A highlighter never has the power to pull everything in that book up your arm and into your brain. I've known of students that got the books and then they just highlighted every word as if that was going to help. That may not help because it's too much. You need to know how to sift. So what did I do? I made like little crib sheets. I took a regular piece of paper, folded it in half, and that gave me 4 sections that I could write on. And let's say you're going to do heart. At the top of one of my sides, I would write angina. What it is, S&S, signs and symptoms, what's the patient going to come in with? What's the labs and the diagnostics that I'm going to know this is the angina? What tests? What do I need to be concerned of? If we're sending him for a cath, let's say that, what do I have to worry about cath? How would I teach him about what a cath is? What would I need to look for? Because when you shoot dye to someone who's going to the cath lab, you better watch. Is he on metformin? Does he have chronic kidney disease? Because we need to protect those kidneys, and you need to know all the different things. And I would write it all on one side. Then I would turn it and see if I could remember and write everything down. Because you see, I'm a tactile, reading, learning kind of person. I like to write it down. Write it down. Then the third time, by now, I can pretty much write it all down without turning back and looking. And by the 4th time, I can write it down. I can recite it. I can teach it to the dog. And guess what? I know angina. Then I would make another one. And it would be for MI. And it would be the same. What is a myocardial infarction? Here is the little definition. And I would do pictures, and I would do shorthand, my own shorthand. And then I would do signs and symptoms and the labs and the what are you expecting and blah, 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 blah. And do the same with cardiomyopathy. And so by the time I got to studying, I would go, okay, I don't need to spend time on this. I know the drugs for this. I know how to do this. I know what's going to be. I know angina. I know MI. I know cardiomyopathy. Do I really know chronic kidney disease as well as I should? And then I know what to study, and I can pinpoint it down. Now, my understanding is enough. A lot of you dear ones don't buy your books, and you just memorize your PowerPoints. Well, I have another tip for you. You should probably have an NCLEX book with cellophane over it that you get right off. What's in that book? Well, you probably have outlines, and then at the end, you've got all these test questions and pre-test questions, and at the very end, you got rationales. When you get your exams, they're going to be multiple choice, and that is so unnatural for the brain, especially if you're a writer. You might know what things are, and you could maybe expound on it, explain it to the T, but when it comes to multiple question, multiple choice, multiple guess, whichever you want to prefer to say that, you got to know who's the distractor, what's it really asking for, and you've got to tune yourself into how to answer multiple choice questions. Why are they multiple choice? They're multiple choice for one reason. We want to get you to be able to pass your boards, and guess what? Nursing boards are all multiple choice. So you already have this marvelous resource. So what do? Go over the outline right quick, flip through it, test yourself as if you're taking the test. If your tests are timed, go ahead and time yourself. So many minutes for so many questions. Fly down through it. I used to say, don't eat your eraser, because we used to have pencils and Scantrons, and you guys have computers now. So don't eat your mouse, I guess, or something, or forget the delete button, or whatever. Don't change your first answer. If you read it well and you answer it right, move on. And don't leave things blank. Don't leave things blank. Think you're going to have enough time to go back. Just go ahead and go through it. Do the best you can and answer those questions. Now, when you're doing it for yourself with your NCLEX book, the greatest part is you get to correct it, and then you get to go to the back. Oh, I missed this. I missed that. Why did I? What did I misread? Oh, it was the most important, not the least important. And then see, your mind has this memory thing that you're going to really look at those specific words. You're going to look at the phrases of the ones you missed. The questions I don't care for are, what is the most important? They used to tell us, well, if it's going to kill you, that's the most important. The greatest piece is you get yourself test ready. Let's say I have a test on Friday and it's Saturday. I'm going to do 25 questions tonight. I'm going to do 25 questions tomorrow. I'm going to do 25 questions Monday, Tuesday. I am going to get in a pattern where I am doing 25 questions every night. And then when I sit down to take that test, and I always said a prayer, Lord, give me discernment. That was my prayer. Lord, please. I've studied. Please give me discernment. Don't let me read into things. Just let me trust. I have done X number of questions. I've done 250 questions. And then you can take a deep breath and realize that you've put your effort in. And yes, I want you to be successful. I want you to succeed. I want you to learn how to sift as to what's important. And then instead of, oh, I memorized the PowerPoint, I want you to own the knowledge. I want you to know why when you give somebody contrast dye do you have to take care of their kidneys. I want you to own that because you see, no matter what the dye is for, that's a concept that you own once you learn it. When someone's presenting with a heart attack, I want you to own it. Why? Because I want you to be the best nurse you can be. And it's not just about the grade. Now, if your nurse educators are going to do a test review, you go. Why? Because you want to know about the ones you missed. So I was teaching a student. She was with me when I was doing heart failure. She was pregnant. She was getting married, and she was failing. She had failed a couple of her exams, and now you guys are really good about adding up all your points. And are you going to make that C? Are you going to make that points to get into the, can you pass? And she said, Donna, if I don't pass, I don't care. I'll just quit. Oh, you don't say that to me. I say, oh no, that is not the way you're going to do this. I want you to call right now. I want you to make an appointment with your educator because what I know, I've been a nurse educator. Your nurse educators want you to know this. They want you to succeed. Make an appointment. She will give you the test. You will go through the test. You will know what you did miss and why. And then you'll do better. She's now out there. She graduated. She passed her exam. She listened to me. She did what she was supposed to do. Had another nurse. She was a graduate nurse. She kept failing boards and failing boards and failing boards. And I kept saying, you need to do questions. Get yourself question ready. And she didn't, and she didn't, and she didn't. And when she finally passed, she came to me and said, Donna, I finally did what you told me to do. Man, it would have saved you a heck of a lot of time if you'd have done it the first time I told you. So yes, I have an awful lot of suggestions for you. You can make songs, you can make poems, you can do word association, I'm happy to help you with anything that you struggle with, I'm telling you. Get on my website, walkthehalls.com. I have some music videos, believe it or not. I have a CD. I just want you to know, I want you to find the best way you can find to be the best nurse that you can be. I want you to go into that room, and I want you to be a CSI agent. And when you have a woman that hasn't been walking, and we've got her heels propped up on pillows, and all of a sudden you see her feet going like this, and you think, what in the world is this? This isn't normal. And you go back and you look at her drugs, and you say to yourself, okay, at what point did this mess of this feet thing going on happen? And you are the one who says, they started a new drug. And then you grab your drug book and you look it up and you find out that the new drug they started when all this foot thing started dancing on the pillow had a Parkinsonian side effect. You see, I want you to be that kind of nurse. And you call pharmacy and they say, kudos to you, Donna, you're absolutely right. And you call the hospitalist and you say, we've given her a drug that's making her feet go crazy. Come on. You've come in and you've done an assessment. Did you see this? Because you know what? Nurses spend more time with patients than anybody. Nurses, PT, OT, love those people. But I want you to be that good. I want you to be that good. I want you to realize we are always learning. I had a student that did really well. She carved out 2 hours every night, and that's when she did her work. Now, your attention span is only 20 minutes, and we make you on a computer a lot. And the saddest part of that is when you're working 12 hours on your clinical days, you're on the computer all day, and then you have to come home and do all this. I want you to take a walk, and I want you to do some aerobics. Richard Simmons is on YouTube. I want you to move, and I want you to watch what you eat. I want to help take care of you as best I can. You got to turn off your social media. It's so distracting. So distracting. And I also want you to know, I'm available. I will help you any way I can. Whatever your struggle is, I have had my certification in medical, surgical, and heart failure, and IV therapy, and critical care. I'm just saying, you just toss me a note if you need something and you're having a problem. I'll see if I can't get you some help. You got to find a mentor, and you got to find someone that cares, because you can't do nursing by yourself. Okay, enough of that. What is the best way for nurses to deal with the grief that weigh heavy on you, and what are the best coping strategies? Okay, one of the greatest things that you can do for you and for your peers and for your family is decide for yourself, what do I think about loss? What do I think about grief? What do I think about death? I'm not scared. I've had so much experience because the way I was raised and the people in my life that have died and our dogs and our friends, and I'm not afraid. And you see, Daddy died. So a lot of it is your story. Daddy died at 66, and now I'm 66. Daddy had colon cancer. Am I going to have colon cancer? I get checked. I eat a lot of broccoli and cauliflower and salads, and I don't know. Used to think that that's what I was going to die from, but... And I want to write the sermon for my minister, and I picked out my songs for my funeral, and I want it to be a celebration of my life. And whenever it happens, you know, it's going to be all right. Because I have hope. I'm one of those people that I believe in the pass on thing. My body will die and stop being around, but my soul is going to live forever. And that's the Christian faith. I'm going to live forever with Jesus because he forgave me of my sins. And what provides meaning? So you ask yourself these questions. What gives you hope? What gives you meaning? What do you believe? How did you cope in the past with someone you loved that died? Or did you cope? Or do you need help with this? If you need help, you seek help, and you don't ignore the pain of loss. One of the books that I love dearly that was actually written for children is Help for the Hard Times. And the greatest thing is he had a stock pot with straps, and he talked about how you can just poke your grief, just like you're adding vegetable soup. You know, there goes celery, there goes the onions, there goes the dog's death, there goes my dad, there goes my grandpa, and you never deal with it. And one of these days it's going to just simmer and maybe blow over. You need to cope with it every time you have a loss. And remember, losses isn't just death. It's sometimes your job. It's sometimes your manager. It's sometimes the healthcare system, or they close your unit, or now you have to work on another unit that you really didn't want to work on. We are constantly, as nurses, giving of ourselves to other people all day long. We are giving our knowledge, we are giving our time, our strength, our passion, and our faith, every part of us. Yet, we are also friends and neighbors, and we are humans, and we have limits. And don't think for 1 minute that you can't go without sleep. I can sleep sitting in a chair. I learned that in nursing school. I could take a power nap in 10 minutes, especially since we have pharmacology at 6 in the morning, right? You need your rest, and you need rest away. So, when you are a compassionate nurse, I want to warn you that they may say something like, oh, this patient needs a dose of Donna. I got tired of hearing that because I ended up with every problem child, every alcoholic. Why are you giving me alcoholics every time I come to work? And I was in a space where they did not know, and I did not share, that my ex-husband was a massive alcoholic. And we were dealing with that, and I didn't have the reserves to take care of these alcoholics, and it crushed me. And the night shifter said, but Donna, you are so kind. Well, then maybe I need to start being mean. But sometimes you need to let them know, I can't take care of every horrible scenario every time, or the sickest, the most complex, because you think I am the smartest. Sometimes you need to say, let's rearrange it. I'll never forget. You're going to find this funny. I had a patient and they said, oh, she needs a dose, Dr. Donna. She was the most complaining, negative person I have ever seen in the hospital. And I thought, oh man, 12 hours. Oh Lord, could I have a little reprieve? So I go into her room and God gave me a little reprieve. Have you ever read, I think it's in Proverbs, how wonderful the little ants are? There were all these little ants all dancing, and here they had built that part of the hospital apparently on an ant hill, and they all came to play in this woman's room. I got to transfer her to another unit, and I could breathe. So as nurses, we're strange. We're strange. But we have to let people know how we feel too, because you can't have the most difficult assignment every time you work. And some people, when they're at work, they don't want to float. I loved to float. It seemed as though every time I floated, there was a reason. Somebody I knew. I had to go to ER once. Guess what? It was one of my ministers. Came in to have a heart scenario checked out, and I was thrilled to death, and it was Sunday, and I felt bad I didn't get to go to church, and then I got to take care of pastor, and that was just really cool. So how do you replenish yourself? Well, guess what? You need a physical, you need a mental holiday. And you have some power. You can enjoy gardening and birding and baking and quilting, and you don't have to stop the things you love. Now, granted, it's hard to put them into your life, unless you sincerely do. Some people actually will go to the gym. They have a friend to go to the gym. The other part of replenishing yourself is you have to have positive people giving positive deposits into your emotional bank account. You need encouragers. You don't need negative Nellies. If you enjoy music or sports or puzzles, you need to spend some time doing some of these things. Don't forget to do the things you love. And now here's the very important thing. If work calls you and you know that they're short-staffed, you don't need to say yes. There's another word in the vocabulary of the American dictionary. It's only 2 letters. N-O. It's a lovely word. No. Can you come in? No. Please come in? No. So easy. I don't have to give you a reason. If you're tired, if you have a family, if you need to sleep, if you had plans, you feel that pull. They feel you have to go. But when you need rest, you need rest. And if you need to take care of yourself, you got to learn to do that. So I give you permission to say no when you're tired and exhausted and you need to break away. Maybe you need to go to the park and walk the dog. Perfect. If I give you permission, that's one thing, but you got to give yourself permission. You don't have to go in every time the hospital calls you. They love you. They want you. They need you. You need you. So do other people in your life. They need you. So it is that balance, that healthy work-life balance, and also good food. I love good food. Don't be caffeining it up. Don't do those sports drinks. That's hard on your heart, guys. Don't take those pills and cause yourself some heart failure. Let me put that plug in. Okay. What are best resources to give to people who are in spiritual distress and experiencing grief, and what should we recommend? The greatest thing is you have got so many people that know those resources beautifully, and that's your social workers. They have lists. Pastoral care, they have lists. Your patients, believe it or not, they are really good researchers, and they have their tablets, and they have their phones, and sometimes they even have a computer on an arm, and they can get online, and they can find what church is closed or what area is closed or what they want to do. They can help you seek out what they need because there are grief support groups everywhere. A lot of people that go through grief jump into grief counseling. I had a friend whose husband got kicked in the chest by a horse. I took care of him the day he died. Met her again at a Christian retreat. Her story is in my book, I Never Walked the Halls Alone. She became a grief counselor. I have another friend, that's exactly what happened. Her husband had a massive heart attack. Saddest thing, we all loved him. He was a member of our church. He was a wonderful man. And she now has a grief group in our church. So, a lot of people who have experienced it have jumped into it as a counselor, has jumped into it and are helpful. And some of them even come and speak to your patients. Does it eventually come natural to have something to say to someone when they're in the grieving process, or does it all depend upon the individual? In your career, your patients and your families are going to teach you with every encounter that you come into contact with. And yes, it does become more natural because you're going to learn to observe and you're going to learn to hone the skills of empathetic listening, and you're going to know the value of silence. You know, it's precious. You're going to become sensitive. And that's going to make you competent, and you're not going to be uncomfortable. If you're as lucky as I have been, you're going to work with a great unit staff, and they're going to help you. And the hospice, palliative care, chaplains, social workers, they're all going to help you because you know what? You never go to work alone. I used to say, if I thought I had to park my car and go in to work and do everything I know I'm going to have to do by myself, there's no way I'd get out of the car. I'd get fired quick, wouldn't I? But when I have a good head nurse, and when I have a good nurse manager, and I have a good clinician, and I have a brilliant team leader, and I have people that don't mind to help, when you pick where you land for your job, you make sure they have those characteristics. Don't ever work somewhere that you have no help, because you can't do nursing by yourself. I wouldn't want to do it anyway. Never really had to. And we are at the end. The fifth session, we talked about offensive conversations, different word choices that we can use, the sadness and the grief of dementia, how it's an unexpected situational loss, what is offensive, how we can be religious and non-religious and still take care of spiritual things, the spiritual impact you can have, your faith, and self-care and nursing school survival tips. And I can actually make you another YouTube if you want to, just let me know. Thank you so much. And again, you know I'm very proud of all of you. And I will continue with session number 6. And life is getting better and better as you're getting your answers. So God bless you.